Muscle pain, sometimes referred to as myalgia, is a common condition that affects people of all ages. Almost everyone experiences muscle pain from time to time. This pain can occur in a small area of the body or, well, it might affect the entire body. It may range from mild discomfort to severe pain that limits movement. Muscle pain might appear suddenly or, develop gradually over time. It can also worsen after physical activity or during certain times of the day. The pain might feel like soreness, stiffness, cramping, or even a burning sensation. So, how long does muscle pain last? Well, most muscle aches and pains go away on their own within a short period. However, in some cases muscle pain may persist for months. This discomfort, honestly, can affect any part of the body, such as the neck, back, legs, arms, or even the hands. Alright, let's talk about the common causes of muscle pain. The most frequent causes include stress, overuse of muscles, and minor injuries. This type of pain usually affects a small number of muscles or, a specific part of the body. Muscle pain that affects the entire body is often caused by, well, a few different things. Infections like the flu can be a major culprit. Then there are medical conditions that directly affect the muscles. And let's not forget, side effects of certain medications can also play a role. Now, let's dive into some specific causes of muscle pain. Here are a few detailed ones to consider. First, there's chronic exertional compartment syndrome, which can occur after repetitive activities. Then we have myalgic encephalomyelitis, also known as chronic fatigue syndrome. Claudication, which is pain caused by poor blood flow, is another factor. Dermatomyositis, an inflammatory disease that affects both the skin and muscles, is also on the list. And lastly, there's dystonia, which involves muscle contractions that can cause twisting or abnormal postures. Hypothyroidism, which is an underactive thyroid gland, can contribute to muscle pain. Influenza and other viral infections are also common culprits. Vitamin deficiencies, especially a lack of vitamin D, might play a role as well. Conditions like lupus and Lyme disease are known to cause muscle discomfort. Certain medications, particularly statins used for managing cholesterol, can lead to muscle pain too. Muscle cramps, strains, or tendon injuries are other possible causes. Myofascial pain syndrome and polymyalgia rheumatica are also conditions to consider. Inflammation of the muscles, known as myositis, and rheumatoid arthritis are potential factors. Sprains, which are ligament injuries as well as electrolyte imbalances like having too much or too little calcium or potassium, can also be responsible. It's important to know when to seek medical attention. You should seek emergency care immediately if muscle pain is accompanied by difficulty breathing or dizziness. Severe muscle weakness that interferes with daily activities is another red flag. A high fever paired with a stiff neck is a serious concern too. And of course, any severe injury that limits movement, particularly if there is bleeding, warrants immediate care. There are also situations where scheduling a doctor visit is the right step. For example, if you notice a visible or suspected tick bite, it's a good idea to get it checked out. A skin rash, especially the bullseye rash linked to Lyme disease, is another reason to see a doctor. Muscle pain in the calf that occurs during exercise but goes away with rest could indicate an issue. Signs of infection, like redness or swelling around the muscle, should not be ignored. If you experience new muscle pain after starting or increasing a medication dose, especially cholesterol-lowering drugs, it's worth consulting your doctor. Lastly, if muscle pain doesn't improve with self-care, it's time to seek professional advice. Now let's talk about home care and treatment. Muscle pain during or after activity often signals a strain or overuse injury. This type of pain can usually be managed using the RICE method. First, R for rest. Take a break from your regular activities, but as your doctor advises, resume gentle movement and stretching when appropriate. Next, I for ice. Apply a cold compress or even a bag of frozen peas for about 20 minutes 3 times a day. Then, C for compression. Using an elastic bandage or compression sleeve can help reduce swelling and provide support. Finally, E for elevation. Raise the affected area above heart level, particularly at night, to help minimize swelling. These steps can be quite effective in managing muscle pain at home.